everyone. So today we are going to discuss about superior oblique muscle, its anatomy and its function, right? So this was a muscle which is innervated or which gets its innervation by the trochlear nerve or the cranial nerve fourth. So this is a muscle that helps in the movement of the eyeball, right? So let's move on. So the superior oblique muscle originates from the body of the sphenoid bone. Over here you can see the annulus of Zinn, but this is the annulus of Zinn, that's fibrous tissue from where the rectile muscles originate. But this sphenoid bone, superior oblique muscle, this is the superior oblique muscle, and this is a pulley from which the pulley or the trochlea from which the superior oblique gets turned and gets its insertion in the posterior side of the eyeball, right? So this superior oblique is originated from the body of the sphenoid bone, right? And it is medial to the annulus of Zinn. So here you can see this is a medial side or the side that is towards the nose. From its sphenoid attachment, superior oblique runs anteriorly. Anteriorly means that it moves forward. Near its insertion, the muscle tendon hooks around the cartilaginous pulley called the trochlea of the superior oblique. From the trochlea, the tendon takes a sharp posterolateral turn before inserting onto the posterior supralateral surface of the eye on the sclera. So this muscle originates from the medial side of annulus of Zinn, from the body of the sphenoid bone, and then this muscle moves anteriorly or towards the eye, and then there comes a pulley, which is this muscle tendon or cartilaginous pulley, the pulley that is made up of cartilage, which is known as a trochlea. From this it takes a turn and go to the back side. Over here you can see it move to the back side, and then it gets its insertion onto the posterior side of the eyeball, right? So here they have mentioned posterior, that means the back side of the eyeball. Supralateral means that the up sclera, that is away from the nose, so that is towards the out temporal side. So there it gets its insertion. So this is how it gets its this is how the origination and insertion of superior oblique muscle is. So what is the function of the superior oblique? This is a muscle, it's a cyclovertical muscle which has its vertical function as well as its torsional function. So superior oblique muscle have its primary, secondary and tertiary function. The primary function of the superior oblique is that it helps in the intorsion, in the rotation or the torsional action, that is intorsion or the incycloduction, and it moves the 12 o'clock cornea towards the nose, right? This means the intorsion, and it helps in the depression of the eyeball. This is something important, that it helps in the depression of the eyeball when the eye is in the adducted state, right? And the tertiary function of the superior oblique is that it helps in the abduction of the eye, which means to move the eye away from the nose. So here you can see this is a trochlea from which the superior oblique muscle get a turn. So oblique means that it has a turn. That is why they have primary function of a cyclo. So they have cycloduction primary functions, right, or the rotational primary function. So this here you can see its insertion point. So this will help the eye to move inward.